Welcome and thank you for coming to the Safe Walking Summit. I am Debbie Spiliotopoulos, the lead on Shared Virginia Roads and a senior environmental planner at the Northern Virginia Regional Commission. Our focus is on the role of community in walking safety and walkability, and our main goals are what actions we can take and what tools are available to improve safety on our roads for vulnerable users. This is the third summit hosted by NVRC's Shared Virginia Road Safety Campaign. The first was in person, where we trained in walk audits and performed tabletop analyses of regionally challenging intersections for pedestrians. Last year, we pivoted online, addressing data resources and developing a whiteboard training on how to lead walking audits. Right off, I want to thank my amazing partners putting this program together. Their insight, time, and leadership have made all the difference. Shakori Shelton of Bike Walk RVA Sports Backers, Mike Doyle of Northern Virginia Families for Safer Streets, Sonia Brihe for Coalition of Smarter Growth, and Lisa Campbell of Bike Loudon and our Share Virginia Roads LCI graduate, and Kate Kraft of America Walks. I also want to thank Alexandra, Prince William, and Loudon staff for participating in this panel and later today. This project is generously funded by Virginia DMV, and I appreciate the leadership and engagement from Kimberly Burt and her colleagues. We have over 100 people registered for this training, coming from all over Virginia and with great representation from Maryland and DC. Following this summit, we will produce a brief resource guide. Now for some housekeeping. The training is being recorded. Please remain on mute, and we welcome and encourage your comments and questions in the chat. Even if they're not answered during the session, we will use them to highlight interests, resources, and concerns. I will try to be online in the main room throughout this session to provide technical support. The two breakouts were assigned where there should be more engagement and opportunities to learn from our featured programs. Let me know if you're not assigned by direct chat when we get to that point. We will circle back at the end to share actions, next steps, and recommendations. The outcome of this summit will be a document highlighting our resources and tools. Right now, I am so honored to invite you to hear from our three keynotes who will welcome you and set the stage for the next 2 hours. We will start internationally, moving down to the state level, and I'll introduce now to pass everybody now to pass the presentations more smoothly. Ralph Buehler is a professor and chair of urban affairs and planning in the School of Public and International Affairs at Virginia Tech's Research Center in Arlington, Virginia. His research has an international comparative perspective, contrasting transport and land use policies between Western Europe and North America. He is the author and co-author of many articles, and his research interests include the influence of transportation policy, land use, and socio-demographics on travel behavior, active travel, and public health, and public transport demand, supply, coordination, and financial efficiency. Mike McGinn is the executive director of America Walks. He has been a neighborhood activist pushing for sidewalks and is the founder of a sustainability not-for-profit. He's a former mayor of Seattle and a consistent advocate on climate and active transportation. He has worked on numerous public education, legislative, ballot measures and election campaigns, and he has an abiding faith in the power of people to create change. And Kimberly Burt serves as the Deputy Director for Programs at the Department of Motor Vehicles Highway Safety Office. She is responsible for directing and overseeing the Highway Safety Program development and grant-funded projects, as well as working with highway safety partners statewide to reduce motor vehicle crashes, injuries, and fatalities. Thank you all for participating, and thank you all for joining us. And Ralph, take it away.
Thank you very much for the introduction. I'm going to share my screen. You have to unshare yours, I think. Yes.
Okay, I think I did.
Yep, there we go. Thanks to everyone for tuning in and for having me. The presentation today is titled Promoting Walking by Making It Safer, Lessons from the Netherlands and Germany. And you will see there will also be lots of examples from other European countries. Local governments, national governments, state governments try to promote walking because it is very sustainable. It's environmentally friendly. There's virtually no pollution from walking and almost no non-renewable resources are used. It's socially sustainable. It's affordable. It's physically possible for most. And there are physical, mental, and social health benefits from the physical activity you get when you walk. And it's economical. There are low private and public costs, at least compared to building new roadways or even building public transport systems, which I am for, but walking is cheaper than that. And improved health from walking can reduce medical costs for individuals and for society. Safety is very important to promote walking, and the graph here shows you trends in pedestrian fatalities per inhabitant relative to 1990, first in the US, over time since 1990. And we see that first we had improvements until about 2010. And since then, unfortunately, we are sort of backsliding, and pedestrian safety measured as fatalities has gotten worse. Looking at comparison with other countries, we see that the Netherlands, Germany, the UK, and Denmark first had stronger improvements over time between 1990 and 2010, and they didn't have the strong backsliding the United States has. Even if we adjust not by population, but if we try to adjust by how much walking there actually is, so per mile walked, we see this trend again. So first, in the year 2000, we noticed that walking is much more dangerous on a per mile basis in the US than in the other countries. Over time, by 2010, all countries had improved pedestrian safety, and all of them significantly. That's what the little asterisk means there. But then by 2018, we again see for the US over here, the backsliding, and for the other countries, we see continued improvements at a lower rate, but still continued improvements. And you see compared to the Netherlands, for example, or even Germany, walking is 8 to 10 times safer there per mile walked. What are possible explanations? And I'll go into some of these during the talk. One is the increased driving in the US since 2010. Driving is up. Larger and heavier vehicles, which are more of a hazard when hit by those. An aging population, walking infrastructure and street design that's not safe for pedestrians, a lack of speed limits, traffic calming, and other things that accommodate pedestrians, traffic laws and enforcement that do not protect pedestrians, more drunk driving and distracted driving in the US. In fact, these numbers were quite astonishing. In a survey, the CDC compared distracted driving, and 68% of American adults reported using their cell phones while driving, compared to only 21% in the UK, 39% in Germany, and 49% in the Netherlands. Similarly, 30% of Americans in 2011 said they were texting while they were driving, compared to lower rates of 17% and 20% in the UK and in Germany. So distraction is a big issue. And of course, traffic education. So how did we get here? Since the 1920s, US cities have essentially accommodated the car. Before that, everyone was sort of a pedestrian. There were trolleys, horse-drawn vehicles, and pedestrians in the streets. And since then, we have had the minimum car parking standards for new developments. We have provided ample on-street parking. We have used engineering concepts like level of service, where we care about moving more cars faster and get concerned if cars are slowed down. We've built interstates and other major roadways in cities. Our land use ordinances strictly separate land uses and make trip distances longer, which are harder to cover for pedestrians. We have synchronized traffic signals to speed up car travel through our cities. We have constantly spent more on roadways than we have paid, drivers have paid in taxes and fees. And so what you see the pictures here, we have transformed from, this is a shot of Market Street in San Francisco in 1905, to cities that look a little bit more like what we see on the right, cities designed around cars. We've also changed our thinking about walking. While it was common in the 1910s for people to be in the street, today this is a space that is for cars. This is an ad from, I think, the 1920s, 1930s about a jaywalker. The term jaywalking was invented then. That's somebody who's, of course, crossing the street but they are not supposed to. We've also all internalized the idea that kids are not supposed to play in street, which used to be quite common. And so we have created an environment for pedestrians that looks more like this. This is from the Swedish Road Administration, and the picture captures nicely what an environment in a city looks like for pedestrians. Once you step off the curb, there's the abyss. And every child knows that you cannot step off the curb and it's dangerous. On top of that, we see in this illustration that across this abyss, we have only planks. There's not even a bridge or something. And that means if you're crossing the roadway, you're doing it at your own risk. Even if you have a green light, a car may still make a turn and hit you. I think it's a very nice illustration of what the roadway space actually looks like from a pedestrian perspective. So what has been happening when all these policies were implemented to promote car use? Car ownership went up. This shows you cars and light trucks per 1,000 population in Western countries. The US is on top, but other countries are below from 1970 to 2017, and the trend is up, up, and up. The trend is not only towards more car ownership, the trend is also towards bigger cars and heavier cars. These are the top selling US passenger vehicles for the year 2019. So they're not bought by contractors or something. These are the passenger vehicle sales. This also goes in hand with an increasing use of cars. This shows you the percentage of trips made by car in black, public transport in brown, bicycle and foot in orange on top by country. And you see great variability, but in the US, about 85% of all trips are made by automobile, 11% on foot. And you see, if you go across, other countries have higher shares of walking, transit and biking, and lower shares of car use. Now, the Europeans have been going in the same direction. This is a picture from a German town in 1953, 70,000 inhabitants. We have a trolley running there. We have bicycles in the street. We have some cars already. And please remember this fountain there. By the 1970s, there's the fountain. They changed this place. The trolley tracks are still there, but the trolley is not running anymore. The road has been widened, and it's a space that's given to cars. And of course, the old building is gone. In a process called urban renewal, modern buildings are put up. This is in fact a postcard from that city. They were so proud of having achieved that. Ironically, you see here on the left that this red car, maybe a Porsche or Volkswagen, is nearly hitting the child. It's not on purpose, but they overlooked that fact. But and again, a policy decision. By 2012, there's the fountain. This is an area that's given over to pedestrians and bicyclists. Delivery can come in at certain hours of the day. People with disabilities are allowed to drive there at very slow speeds, but it's a policy decision again, first giving it to the car and then taking the place away from cars. This happened all over Europe. This is Amsterdam in 1971. You can use this street in this way. This is the same street in 2020. They are focusing on bicycle travel and have pedestrians on the side. Similar example here from Copenhagen in their downtown, oriented towards the automobile, and then by local policy decisions turned into a pedestrian-oriented area. The good news is there's great potential in the US to promote walking. About a quarter of all trips are shorter than a mile. 40% of all trips are shorter than 2 miles, and these are distances that most people can walk and are willing to walk if it's made attractive. So how can we encourage more walking and make it safer? We have to build better facilities. We have to traffic calm residential neighborhoods. We have to have mixed use zoning and improved urban design. We have to integrate walking with public transport. We have to restrict motor vehicle use, especially the speed. We have to improve traffic education for motorists, that they know to watch out for pedestrians and know the rights of pedestrians. We have to have traffic regulations and enforcement. And of course, we have to promote walking with campaigns and other events. The first thing many of the European cities did were these car-free pedestrian zones. We saw some examples already where they close off the downtown areas, the inner city areas, and hand this area over to pedestrians. Again, here a picture over time. This is in Freiburg, Germany, where in the 1960s, they used their historic downtown as a car parking lot. And then again, by policy decisions, they did away with the car parking space and turned it into a daily market and into outdoor restaurant seating, so a very pedestrian-oriented space. We have maybe a chance to get towards places like that in our area as a positive outcome of the horrible COVID pandemic. This is a picture from Old Town Alexandria, where they cordoned off one of the blocks on King Street and turned it over to pedestrians and restaurants, and has gotten very popular. The other two are sort of these parklets. The restaurants have outdoor seating for their customers. Another element is, and I alluded to that already, the reduction of speed. This is a graph by the World Health Organization, and it shows you the likelihood of a fatal injury, so the likelihood to be killed by the impact speed of a vehicle. And when we get around 30 kilometers per hour, that's 20 miles per hour, it goes up exponentially. Unfortunately, the speed limits in most of our areas here are too high. 25 miles per hour in most residential areas, We're already halfway up the curve, 35 miles per hour on many of our roads. We're already at 90 or almost 100% of fatal injury when hit by a vehicle. And this is an old graph. The vehicles now have gotten larger, have higher fronts, and have gotten even more lethal for pedestrians. In the Netherlands, the turnaround towards designing for pedestrians and bikes was actually around traffic safety. This is from a campaign in the 70s that's called Stop the Killing of Children. And the killing of children by automobiles was sort of the main impetus for this movement to call for safer streets, especially in neighborhoods, to also allow kids to be in the street, and as we'll see later, even play in streets. This here sort of translates to hunting for small deer every day. It's very provocative, but it was sort of the call they had at the time. Why is speed important besides hitting someone? It's also related to the likelihood of someone being hit. This shows you the stopping distance based on the speed you're traveling in a car. Up is 20 miles per hour. You take about 12 meters or 40 feet to stop. It's part of the thinking distance. First, you have to recognize that you have to brake, and then you brake, and then you stop. And as the speed increases, you see that you will not be able to stop if you see somebody or something 40 feet out because you travel while you think, and then the braking gets harder and harder as you have more speed. Traffic calming can be area-wide. This is the city of Vienna in Austria. Everything you see here in the salmon color and in the green, the dark green and the dark blue are traffic calmed areas. In the city, it's 20 miles per hour is the speed, 30 kilometers. The light green is parkland in the city. Traffic calming is not just putting up a speed sign, but it's also changing the physical layout. So what this shows you here is, for example, a neighborhood street, a left turn. If the vehicle turns here or a right turn, it mounts up to the area of the pedestrian and then goes down into the neighborhood street. So the opposite of what we are typically doing, where the pedestrian goes down into the street and then leaves the street again. So the car becomes a visitor to the pedestrian space. And of course, we have changed pavement to mark these areas. The bollards and bulb outs can help at corners to shorten the crossing distance for pedestrians and of course increase the visibility to motorists. Often closer to crossings, they only allow a bicycle or scooter parking to again increase the visibility of pedestrians. This here is a dead end where sort of through traffic was taken out, but pedestrians and cyclists can cut through. Another picture from the city of Freiburg, again in the salmon color. We have the traffic calming at 20 miles per hour. In blue, we have super traffic calming, and we talk about that in a second. And in white here in the center, we have the city center. And the traffic is really meant to run on the through traffic on the yellow streets we see here. This is the super traffic calming. It's 7 kilometers per hour is the speed limit. It's called a place street or a home zone. Cars have to yield to pedestrians, cyclists, and even to playing children. This is a new neighborhood that was built as a play street. And you really only drive there if you have to go there. No through traffic is gonna go in this neighborhood. And the Germans got the idea from the Dutch, who implemented that, called a Woonnerven, coming out of this Stop the Killing of Children movement in the 70s, which would loosely translate like a living yard. So you have neighborhood streets that are really slow for car travel, and children can even be out to play in these streets. Again, changes were necessary. This is again in Germany in the 70s, cars were even parked on the sidewalks here. And then the road was changed. The entrance to the road was narrowed, signaling to the driver they're getting into a traffic calmed area. Only one car can pass at a time here. There are benches, there's bicycle parking, there's pedestrian scale lighting, there's changed pavement, and sort of telling the driver that they're entering an area now where they have to go slow. This is an example from the city of Vienna, Austria, where they have mixed pedestrians and cyclists in this area, where they can go together. And I'll try to show a little video if it works. 1 second, if it runs. If not, we'll continue. There's the video, and you don't have to hear the sound, but what you can see is this mixed area where pedestrians, bikes, cars, scooters inline skaters share the whole area. You see on the right, there's parking allowed here, so cars can come in to drop things off or pick things up, but cannot park there permanently. And then if cars come through, as we see there in the back, they have to yield to the pedestrians and the cyclists, and they go through very slowly, and they really only drive there if they really have to go there. Otherwise, this is not an attractive route for a motor vehicle. Let's stop the video here. Try to go back to the PowerPoint if I can. Maybe we have to finish it out.
Ralph, I don't think we're seeing it. We're still seeing your slide versus the video.
Oh, I'm sorry about that. Let's see. Yeah, I can maybe send it to you later. We have to continue, otherwise we run out. It's essentially a mix of pedestrians and cyclists. So what do spaces look like that are designed for pedestrians? This is an example from NACTO, the National Association of City and Transport Officials. And transforming the space to be more pedestrian friendly could entail removing car parking to increase visibility, building these bulb outs to increase, again, pedestrian visibility, but also reduce the distance needed to cross the roadway, building crosswalks that are visible and can also be elevated to have motor vehicles mount into the pedestrian area, having tactile markings to announce the crossing to people with visual disabilities, and having median islands so that pedestrians don't have to cross all at once. What are some common problems for pedestrians? And these are just some pictures from around the area. Up here on the left, we have a car that's parked far too close to a crosswalk. There's actually an adult person standing behind, but it's impossible for you as a driver or as a cyclist to see, and you may run into them. On the lower left here, we have a car parked in a crosswalk, and it also demonstrates how big our cars are getting. And these are not the largest cars compared to a child standing in front of them. The lower left here, we have a sign that says yield to pedestrians, but the sign is run over. And by now, the sign at that intersection has actually been removed because it has been run over so often. Again, here a car parked in a crosswalk for whatever reason. This on King Street here in Alexandria shows you many problems. The main one is if you come, it's downhill here, you turn right. It's really a fast curve. You go around this at a pretty good speed, but there's a pedestrian crosswalk with a pedestrian light actually there, but it's very dangerous because you come down fast. The pedestrian who wants to cross here doesn't have a pedestrian light. They actually have to look for the car light, and there are many of them. It can be quite confusing. The last element I have here is a multiple thread, and this is a crosswalk across 4 lanes of travel. Something that you cannot find in many European countries because they don't allow it, because it's considered dangerous. And the problem here is if car A stops and the pedestrian steps out, car B is not able to see the pedestrian because the pedestrian is covered by car A and may run over the pedestrian in the crosswalk because they cannot see them. There are some things you can do about it. They put in these things called shark teeth, which look like yield signs that are painted on the road so that cars would stop farther away, but it's sort of a dangerous setup. Another element I want to quickly highlight is the land use element. This is again from the German city of Freiburg, where they built 2 new neighborhoods, infill developments, and they designed them around transit, that's here in the center, and then for pedestrians in the rest of the neighborhood, with lots of these super traffic calmed areas where children can play. Cars can come in, they can drop off and pick up things, but they cannot park there permanently. And crucially, there's the connection here with public transportation. Of course, we know in this area how to build around public transportation. Arlington is a national leader in that, with the bullseye concept and the transit-oriented development around the metro stations and building in a walkable fashion and a dense mixed-use fashion around these, and that can also help shape the land use. Another element I wanted to highlight is the connection to public transport. It's very important, as we saw from the Freiburg slide now in these new developments, but we also have to think about access to public transport. This is a random suburban street that it shows here with 2 public transport stops here in orange. And if somebody lives at a house here where the globe is, it's about 400 feet to the public transport stop on the other side of this 4 or 5 lane roadway. However, if the pedestrian actually follows the law, it would turn into a 3,000 feet walk to get to the bus and back. And then what we get is people running across the street because they want to get to the bus stop. And it's again a very dangerous setup. Lastly, we have to include the pedestrian rights in motorist training, so that motorists learn when they get a driver's license, first in the classroom and then on the road test, to watch out for pedestrians, drive defensively, and yield to pedestrians where it's required. In conclusion, walking is a sustainable means of getting around our cities. It can provide many positive side effects. Lots of daily trips are short enough already to do so. There are many proven ways to improve pedestrian safety, and reducing car travel speed and designing for pedestrians are two crucial elements. So now I thank you, and I apologize that the video didn't come through.
Thank you so much. That was great. So Mike, we're going to pass it right on to you. Mike McGinn.
Okie doke, getting organized here.
While you're getting organized, Ralph, there was a quick question from Laura, if you could maybe answer it, or she had asked, let's see, Europeans do not allow the sharp left. Do Europeans reduce the road to one lane in each direction at mid-block crosswalks? That was her question. And multiple threats.
So typically, or they provide a median island. So if you look at the engineering standards, I went specifically to look for what to do about these multiple threats. And in most of them, I found at this higher traffic volume, either have a signal to cross there, or they go down to one lane in each direction. And Europe is a big place. So I looked at Germany, I looked at the Netherlands. I think there was a third country I looked at. So you may go to Bulgaria or Romania and find something different. But in general, that's the rule.
Is my screen showing?
It does.
Okay. Well, I'm glad to be here. I'll try to be quick. I'm Mike McGinn. I'm the executive director of America Walks, and I've been in the job for about 10 months now. I'm getting on to a year. I won't be able to call myself new anymore. This is a shared street in Greenwood behind me, in my own neighborhood in Seattle. So first, just a few things about America Walks. We support local advocacy across the country. That's really what we care about, because that's so many of the decisions about streets and land use and safety are made at the local level, although there are decisions made at the national level as well. And we'll talk about that. We work in coalition with others, and we want to try to, be in a position to move the debate nationally. We do so different ways. We have our walking college, which is, we're funded by the Centers for Disease Control. We train advocates around the country. I think we've had 6 now, national walking colleges, and we're heading into the 7th. We also have state walking colleges, which are in partnership with AARP, with their Livable Communities initiative, where we're also trying to train advocates as well. Also, we have our webinars, and I really recommend, we're really trying to focus our webinars on the issues that are relevant, and also things that would be valuable to advocates, and trying to figure out how they do their work. You can find us on YouTube as America Walks. All of our old webinars are there. This year, I was talking to somebody earlier today about this year just being, I don't know if there's been a year which has had so much action on just these issues, putting aside everything else. So momentous, but it's really changed the world quite a bit for us as well. This is from one of our webinars, Tabitha Combs, a researcher, and I won't try to show you everything on it, but that blue line going up at the top, that was street space for pedestrian and bikes over time across the country, and how much it grew. And then the purple line was street space for commerce. We just saw across the country roads being converted for use for people, for recreation, for health, for transportation, and for commerce. And really one of the big questions is, are we going to stick with that? We started to see some of that pedestrianization even that was just discussed in the prior one. And what was fascinating was apparently 90% of those things were not from previous plans that were now enacted. They were actually done quickly, and it just demonstrated that government can move quickly when it feels it's important to in this context. Another huge issue, of course, was understanding the issues, or better understanding the country coming more to grips with the issue of mobility justice. The fact that our Black and brown neighbors are more likely to be stopped on the street by law enforcement, and that really affects whether a place feels safe for walking to people, or whether a community feels safe to people. And here, Virginia has taken a lead. It's still not legal to cross except at a crosswalk or an appropriate place. But Virginia's new statute says that police officers won't stop people for doing that. So walking in the street is becoming something you're allowed to do again. And Kansas City did it. California is trying to do it. I hear from a lot of advocates that this is something that they want to take on as an issue. And while this involves walking, these issues also apply generally to bias in policing. We got really involved with the issue of, oops, I went forward, of the issue of the Manual of Uniform Traffic Control Devices, the obscure document that's the most important pedestrian safety document you never heard of. And it kind of speaks to, it was a 10-year revision. And in this revision, there were apparently over 29,000 comments submitted. And that just speaks to the demand from local communities for better and safer streets. This is an example. This was a story that ran on Streets blog. There's the link will be provided in our materials about how it was impossible to get a crosswalk to cross from a low-income neighborhood to this food store. It was actually just a mart at a gas station, but for this low-income neighborhood, it was the closest place to get groceries. And the Manual of Uniform Traffic Control Devices prohibited a crosswalk here because not enough people crossed, even though many did, and because not enough people had been killed. And those are the types of rules we're working to get changed at the national level. And a lot of that was done with input from local folks. And we also had, we put out an action alert. We did a webinar on this as well. I think the other big issue we're going to see, in addition to what we've just been talking about, local action in response to the pandemic is one. Mobility justice is another. A new administration, we were just talking about the MUTCD, but the appropriations bills going through Congress, the stimulus bill, the transportation reauthorization, all of our issues are in play here, probably in a way that they never have before. I can't possibly attempt to use this 10 minutes to talk about it, but it really is a new day. And here's an issue that's coming up. Europe now has cars that are, in Europe, you must put speed limiters in new cars coming out so that your car would automatically slow down when you're in places where it should slow down. And so this is a case where the autonomous vehicle technology, and obviously there are a lot of concerns about how autonomous vehicles will work and whether they will ever be ready to share the road with pedestrians, but there's technology that could be integrated into vehicles to make it safer for pedestrians. And this is the next thing we're likely to see here. I went too far ahead there. This is the next thing we're likely to see here is we regulate cars for the safety of people inside of vehicles. And under the Obama era, there was a rule to regulate vehicles for the safety of people outside of vehicles. It's what Europe does as well. So that's another place for national level action. Moving forward, I was trying to find some good examples of local advocacy just to get people thinking here about what they might do against the context, as I said, of just a real national awakening to the value of walkable communities that's been occurring and is even stronger now. Oregon Walks did a really deep dive. They got all of the data of every pedestrian fatality in Portland. The lighting that was there, the design of the road, the circumstances that occurred. All too often, pedestrian fatalities or the analysis of collisions is done to determine who is at fault between the driver and the pedestrian or between the drivers. This was an attempt to look at all the factors that are involved in it. It was pretty labor intensive, but it was also very revealing. So this is something that we think other folks around the country should be looking at doing, and it shouldn't have to be done by advocacy organizations and volunteers. It should be done by government if they're truly serious about Vision Zero. This is a really fascinating campaign in the state of Washington, Disability Rights Washington. What they've done is they've focused on people that don't own cars and told their stories using videos. So in this case, the map on the right that shows the story map, they've made videos and told the stories of individuals in each of these communities. The local newspapers obviously want to report, and will share that video and spread the word. And they were also putting together, therefore, a statewide coalition. Legislators from around the state were hearing about what it was like to live without a car in these communities. And I just think it was a really innovative campaign. Here was another fun, innovative idea from the Zoom era that I enjoyed seeing one day. It just popped up on my screen. They did a Zoom walk audit. This is Green Lake, and they wanted to show the conditions all around the lake. It's a very popular lake. It has good conditions in some places, really bad in others, because the roadway on the far side is a very fast road. They stationed people at different places, and they were all on a Zoom call together with their phones, and each one reported on what they saw. So it was just a fascinating use of new technology. This was on the call. You can see everybody there. And yeah, they did a virtual walk audit using Zoom in their phones, and which is now cataloged and saved, and they can share as well. Speaking of videos, this is the other thing I've noticed. TikTok now has videos. I don't know if any of you have found Mr. Barricade on TikTok on the right. How important is Mr. Barricade? He has something like 450,000 followers. He's a traffic planner in California, and he puts together short TikToks explaining why they do things to roads. This person at Talking Cities makes little videos about how you can convert a road from one to the other. In this case, I think he's had millions of views of his videos. So we often talk about what's the right message to win, but it's also how do you spread the message to reach enough people. And so we oftentimes talk a lot about what the policy should be to achieve an objective. And really it's changing public demand and changing the culture of our country that will really lead to the change in policy first. And these ideas about designing safe streets and having open streets and converting automobile space to other space is finding new outlets in TikTok. I have not yet done TikTok. I don't feel like I can pull it off, but if it's worth seeing what's going on there, and who knows, maybe someone in your group will have the capacity to start spreading the word about what safe streets are and should be. I mentioned earlier that we do webinars to try to support advocates. This is one where we did focus on message. I'd recommend, we have a lot of webinars, you should watch them all, but if your goal is how can I put together a compelling presentation, really recommend this one as well. The presenters were really great to think about how do you develop a message that's compelling to an audience. Okay, I'm trying to keep it tight, keep us all on schedule. We really need to thank Active People, Healthy Nation, which is the program of the Centers for Disease Control. They fund a lot of our work. They launched under the previous administration. I think they can continue to expand under the new administration. I recommend people sign up and join Active People, Healthy Nation. We'll send out a link on that as well to stay in touch. And the key thing about this approach is no longer is the government focusing on trying to change individual behavior. They're focusing on systems change. How do we change the places we live, how they're designed, how they're built, so people can integrate activity into their everyday life. And we specifically are funded to support activity-friendly routes to everyday destinations which is what we do. So with that, I think that's my presentation on what's been going on nationally, some ideas about things that other advocates are doing around the country. And I hope that spurs some thinking about what the folks here in this conference can be doing in the weeks, months, and years ahead. Thank you.
Thank you. Thank you so much. That was amazing and really great ideas for us to think about. And next I want to share with Kimberly Burt, who is with Virginia DMV. Kim, do you want to go ahead? Make sure you're unmuted. There you go.
Yes. Good afternoon, everyone. I was trying to share my screen. I'm hoping everyone sees our DMV website page.
Yep, it looks great.
Great, thank you. Again, welcome to each of you that are participating in the Safe Walking Summit being hosted by Northern Virginia Regional Commission. They have been one of our strong partners in the area of highway safety and pedestrian safety here in the Commonwealth, and we thank them for their efforts, and we thank all of you that are here today to learn more about safe walking here in Virginia. I wanted to share a little bit of data with you. As Debbie indicated, I am the Deputy Director of Programs with the Highway Safety Office at the Department of Motor Vehicles, and one of our focus areas is pedestrian safety. My particular area, we oversee the grant funding and program development based on the projects that we fund for highway safety. The data that we've received, Virginia pedestrian data is trending downward from 2019 to 2020, which is great to know that we are trending downward. Virginia realized a 8% decrease from 2019 to 2020, with 10 less pedestrian fatalities, which that's good. We're glad to see that downward trend. Our traffic record electronic data system data reflects decreased pedestrian crashes, fatalities, and injuries. Currently, DMV is working on producing a pedestrian safety message, which we hope to release in July. So in about 30 days, we will be releasing a new pedestrian safety media campaign, which we are excited about that. And again, we want to thank you all for continuing to support pedestrian mobility with messaging and education to all. We have made it a priority of our office to ensure all of our highway safety messaging, not just pedestrian safety, reflects diversity, equity, and inclusion. So we are continuing to make that a priority for our office, for all of our focus areas, to ensure every Virginian is receiving or understands that message and the messaging relates to them. So again, we've made that a priority. Dwight Jenkins is our bicycle pedestrian statewide coordinator. He is actually on leave this week, so he is unable to be with us. So that's why I'm filling in. Again, I welcome each of you to this summit. Thank you again for your continued support as we all work together to decrease our pedestrian fatalities, crashes, and injuries. There on the screen, I'm hoping many of you are aware of this. We will hold our 2021 Virginia Highway Safety Summit. We are doing a series this year. It's virtual. We're doing a session on the 13th and the 14th, and then the 20th and the 21st. The opening would be on July 13th. We will be getting more information out so that individuals can register for the summit. But we have a very great summit series planned this year. We're doing it virtually. Last year, we had to cancel it due to the pandemic, but we are excited that we're able to host it again this year. We have various topics that will talk about or focus on our priority areas. One of the sessions is how do we change risky driving behavior? And in that particular session, we do have a partner that will be speaking on a pedestrian safety project that has been funded by our grant. So I'm hoping each of you will be able to register and join us virtually for this particular summit, and we're excited about it. And we're continuing, as our theme is for 2021, moving forward together. And it's going to take all of us to bring about that change. So again, thank you and welcome.
Thank you so much, Kim and Mike and Ralph. You guys did an amazing job. I think we're actually on time, which I didn't expect. I figured we'd be late from the start, so thank you all for being quick. We're ready to move into our next session. Let me see, something weird happened with my screen. So I'm pulling up this is just the agenda that we have coming forward. So we're right now at Virginia Community Initiatives. So I will pass the torch over to my partners.
Okay, well, welcome. Hello, I'm Sonia Brehe. I'm the Northern Virginia Advocacy Manager for the Coalition for Smarter Growth. I'm super excited to be here today as part of this Virginia Community Walkability Initiative session. We're grateful to have these two panelists today to talk about their community-led programs that work here in Virginia to improve walkability and advance safe streets. The slide's still on the screen, but just as a quick reminder, please, you're encouraged to use the chat. There's been some good dialogue in there already, to chat your questions and comments that you have. I don't think we're going to have time to really get into answering the questions during this session, but what I'm planning to do is we're going to take the questions into the breakout sessions where we'll have a greater opportunity to sort of have dialogue and more question and answers. So let me quickly introduce our two panelists. Mike Doyle is the founding member of the Northern Virginia Families for Safe Streets, with chapters in Alexandria, which was the first, Arlington, and Fairfax. Families for Safe Streets is an all-volunteer organization dedicated to building awareness and support for safe streets in Northern Virginia, so all people can walk, bike, and drive safely. Shakoria Shelton is the lead organizer for Bike Walk RVA, a program of sports backers in Richmond. She spends the majority of her time expanding Bike Walk RVA's network of grassroots advocates and empowering them to be leaders in the movement toward a walkable, bikeable Richmond region. So let's get started. We're going to kick it off with Mike Doyle. Mike's got it going. Great.
Okay, thank you very much, Sonia, and thanks, Debbie, for inviting us. So we are Northern Virginia Families for Safe Streets. We have 3 chapters, as Debbie said, in the Northern Virginia area. And we focus on pedestrians, but also cyclists and all vulnerable road users. Our mission is to tell the impact of stories of people that have been crashed into by vehicles, whether they're pedestrians or any vulnerable road user. Some of our members are crash survivors, and others are family members who lost somebody. We also try to enhance public awareness of street safety risk. We do educational programs in the public and at the legislative level. We do a lot of advocacy about traffic regulations at the legislator, policymaker level. We also cooperate with jurisdictions on road project safety, and I'll show you an example. And then most recently, we've done an upgrade on our, pardon me, our new MISS Dangerous Location Survey. And our membership, as I said, are the crash survivors, families who lost somebody, and by and large, concerned citizens. We have about 1,100 members in Northern Virginia. And we started a little quick history, sorry. We started Alexandria in 2017. We've worked with the city, we worked with the police department on Vision Zero programs. We work with the school district on promoting Vision Zero education programs. Our not-for-profit is right now at the Alexandria Families for Safe Streets. We'll move it up to the to the Northern Virginia regional area. We have shown in local print and some TV. Arlington, Families for Safe Streets was started in 2019. We have roughly 150 people on that email list. And we're right now, among other things, advocating strongly on the Vision Zero program, specifics on that program. It's a great plan. We're looking for the specifics on that program in Arlington. In Fairfax is our newest chapter, started in the fall of 2020. We have roughly 120 people. We're advocating for infrastructure changes, particularly with VDOT. We can talk a little bit about that later, and traffic regulation changes. So NOVA Families for Safe Street is just the umbrella organization. Our advocacy with policymakers, we've been in Richmond or zoomed into Richmond, different transportation committees, et cetera. And we've had some support, involvement with the hands-free law. I mean, we're just supporters, but we do show up at meetings and tell stories about where these laws are important. We were very active in the vulnerable road user law, which is new, to stop the crosswalks for pedestrian and all vulnerable road users. The 15-mile-an-hour speed limit at the discretion of the jurisdiction in neighborhood residential areas as well as business districts. So we advocated for that at the state level, and now we're advocating for that at the local level, at the county level or city level. We advocated for the automatic speed enforcement, and it got a little bit broadened to the schools. It's work zones and schools, and we're trying to strongly advocate on the regional basis to encourage the police to collect the data so we can show some of the legislators in Richmond that it does work. They won't accept data from outside states or cities. They want to see it in Virginia. So we need to get that data collected. The public awareness, Ralph, I'm sure everyone on this call realizes the risk of speed and speed kills, speed maims. This is the type of thing we'll do in presentations or handouts on that. We also do the left turn. In many cities, Alexandria, we have the statistics, but other cities in New York, it's even higher. It's a 2-to-1 ratio or 3-to-1 ratio. Left turns crashing into pedestrians versus right turns. And it's really simple to avoid. But that's part of the advocacy. Another one we do, this is for the children, but it's really for the adults also. The stop, look, and wave, not look, wave. The difference, some people talk, oh, just stop and look into the eyes. Having been there, having been crashed into in a crosswalk, I could tell you, you want to make sure the driver is engaged and the pedestrian is engaged. When you're waving to each other, it's friendly, and both are engaged by definition. So we pass that on to the children, but also to the adults. We have this in different languages as well for handouts at schools. The cooperation on road safety projects. So we're a little more established in Alexandria, and some of the things we've been doing as a group. We've done an uncontrolled crosswalk audit and 450 uncontrolled crosswalks. So it's volunteers going out, identifying these uncontrolled crosswalks and doing a report on that. We also just recently did an audit on the yield versus stop for pedestrians at traffic lights. Everyone used to have the yield, now the law is stop. So we've identified the signs that need to be changed. And we'll be talking about in a breakout session, we've upgraded, thanks to Virginia Tech Graduate School of Urban Planning, our near miss survey. So it's really a near miss and dangerous location survey. And it's on Esri, and the platform is, and it can pinpoint the exact location of where a near miss or dangerous location has been identified. And that's the hyperlink. And this is a quick, the survey is pretty granular. It goes, you know, you were a pedestrian, you were on a scooter, what was the date, what was the time, who was doing the dangerous behavior, etc. And then we take this data, we map it, thanks to the Esri platform. And here's an example where these little red dots are near misses. So we've been doing near miss reporting in Alexandria for a while, over a year and a half. The yellow on this map is the heat map of the VDOT treads. That's the crash data. So our data that we're collecting on this near miss is more of a real-time crowdsourcing. Fortunately, they're not crashes yet. The crash data, treads, is history. And so what we hope to do, we're a small little not-for-profit, but our aspiration, now that we have this better survey on our website, is to be able to do the data analytics and correlate the data on the near miss to the crashes. The crash data from VDOT is pretty granular as well, so we can do comparison and do, perhaps, our dream is to do predictive analytics. But in our maps, we also break this down into districts so that from a policy and advocacy point of view, you can look at where these reports are and where the near misses and dangerous locations are by election districts, by county, and by, in the case of Fairfax, by the supervisory districts. And so that's a brief overview of what we are about. We really do multiple advocacy, education on traffic regulations, road infrastructure, both local and state level. We try to do the public outreach programs. We try to work with the schools, and our near miss data collection, we believe can be helpful. But it's critical. Not only do we get the data, we have to share it, and the jurisdictions are willing to accept it. We found very good acceptance in Alexandria. We're starting to make that communications with Fairfax, and we look forward to Arlington and that opportunity to share it. Thank you.
Okay, so Shikoria. There she is.
All right, good afternoon, everyone. I'm here to share about bike ped counts that we have going on in the Richmond region and how we can scale them to our local communities. So just to get us started, this is a public-private partnership between Bike Walk RVA, which is a program of sports backers, and the Richmond City Health District, which is a more public entity. Sports Backers is a local nonprofit in the Richmond area. And what we do is we inspire people from all corners of our community to be active. And specifically Bike Walk RVA, we advocate for comfortable and connected places where people can bike and also where people can walk of all ages and all abilities. The Richmond City Health District, they work more in the policy programs, and they build partnerships so that all can promote, so that they can promote equity, and so that all in the Richmond region can thrive. Joining me today in the breakout session will be Sarah Shaughnessy. She is the Built Environment Specialist with VDH. And then you see myself, as well as Jada Jolly, who's also working on the project with us. To get us started today, I want to engage the audience, and I want to launch a poll that's just going to ask, what's your level of familiarity with bike ped counts? So I'm going to go back. Got a couple more people responding. All right. I'm going to go ahead and close it. So if you have not yet voted, go ahead and do so. All right. So here are poll results. The majority of this crowd know a moderate amount about counts. So that is wonderful. But we do have an even spread between those who have never heard of counts and then those who have heard of counts, but maybe don't know very much about it. And then we know a couple of people who know a great amount about counts. In this presentation, we'll give an overview of what counts are, how we conduct counts in the Richmond region, how you can conduct counts. And then if you join us in the breakout session later, we'll talk a lot more about how you can actually scale them in your community. So I'm going to close the poll there and we'll get back into the presentation. All right, so bike ped counts are conducted twice yearly. We do them in May and September, and it's really to collect data on how many people are biking and walking. And we say in Richmond, but they're done across the nation. We do this to demonstrate the effects of protected bike and pedestrian infrastructure that's already in place, but we do it also so that we understand where should new infrastructure be planned. Where are people, where are people's routes taking them? How can we show with the data where people need routes to get to and from their destinations? This is a component of the National Bicycle and Pedestrian Documentation Project, which is a national effort that's led by ALTA and the Institute of Transportation Engineers. Pedestrian and Bicycle Council, sorry about that. And they developed this survey, this methodology, because we realized that there is no consistent or uniform data collection and analysis on non-motorized modes of transportation. So we know how cars travel, where cars travel, how frequently they travel, but do we have that data on bikers and walkers? We didn't. So they developed the system just for that. So each agency, which we in Richmond are our own agency, we conduct our counts using surveys and we do our own analysis. So this is a volunteer-led effort. It's not paid. It's based on the jurisdictions and those who are doing their own counts. But it's also, there was little data that was shared, national data. So we had data at the local level, we had data at the state level, but nationally we weren't able to see those trends. So that's another reason why this was developed. Some things that counts do is to justify funding. It documents why people should, or not why people should walk, why we should spend money towards infrastructure for active transportation. So we document the benefits and what things influence walking and biking. Now that we have this project, and now that this is something that's uniform collection, we now are being able to see what national data looks like, and we can see locally at the state level and nationally what those patterns in bicycle and pedestrian activity look like. So in the Richmond, Virginia region, we've conducted counts since 2014. So that's 7 years of data. And currently we're at 33 locations within the Richmond region, as you can see in our map here. At each of those locations, we have volunteers go out 3 days of the week, and they're out there for 2 hours. So over those 3 days, we have just under 100 volunteers who come out and sit and count for us and with us. So I mentioned before that this is a partnership between Bike Walk RVA and the health district. So some of the things that we each do separately, Bike Walk RVA and Richmond City Health District, we plan together. So we identify locations that we want to do counts at. We pick the days, which are pretty much the second week in May and the second week in September, following the national guidelines. Then Bike Walk RVA does a lot of the recruitment. So we reach out to a lot of people in our database and ask them to volunteer with us. I'll show you some more on how we get our volunteers on a little bit, but we also do the day of coordination. So we send out the orientation materials. We send out information on the day of to remind people you're at this location at this time. This is what we need from you. This is how your day will go as you're conducting your counts. So then the Richmond City Health District will come up with the training materials for our orientation. They'll collect the data, and then they'll also do the data analysis. And then we'll both collectively share those results out after we've done some editing. Our volunteers are super important in this effort. So they'll sign up, they'll go out and they'll conduct their counts, and then they submit their data to us. And while doing it, they're having fun. So just to share a little bit about how we obtain our volunteers, Bike Walk RVA has a database of just under 60 or 70,000 people. So in the Richmond region, we narrow it down to about 4,000 that we send emails to ask them to sign up. So we also use social media outreach. We connect with our personal and professional networks, as well as reaching out to previous volunteers and getting them to come back on board and bring their friends and family as well. Then we have partnering organizations who come each and every year and do this with us, and they share it on their platforms as well. And then how do our volunteers conduct counts? So you might be wondering, when volunteers go out, what do they do and how do they know to do them? So we say it's a 5-step simple process. You sign up to volunteer. So we use Sign Up Genius as our platform. Volunteers will pick their day and they'll pick their location. So maybe if there's a location close to their house, they'll pick that and they're good to go. So on the day of or the day before, they'll review where their location is and they'll review the orientation materials that are sent out. They'll go to the selected site at the designated time, and we do 5 to 7 p.m. And while they're there, they'll sit and they'll record pedestrians and bikers in 15-minute increments, and we provide count forms for them as well. After those 2 hours are done, they'll just scan or take a picture of their form, and they'll send it to the Richmond City Health District for analysis. So what we do with the data, we compile all of the counts from all the locations together. With that, we do some basic analysis to see, okay, what does it look like over time? What does it look like compared to the spring? What does it look like compared to the fall? What's going on? We see, or I'll show you in a couple slides from now, we saw a big uptick on pedestrians and bikers during COVID. There were so many people out just getting physical activity, and we saw that in our counts. We'll also compile the report. We send that report to the National Bike and Pedestrian Documentation Project. We also send it to local transportation planners. We send it to advocates in the area as well, so that they can share with their city council members, they can share with others in their networks, and we also share it out with our volunteers. As I was discussing just previously, here you can see the change in activity just from 2019 to 2020. We're seeing, if you look at our pedestrian activity, we're seeing a 640%, 43% growth in the amount of walkers in certain areas. So this location actually just got new bike lanes in. So we're seeing people are out and using that infrastructure that's put in. So that's why counts are important, and we're constantly sharing this information. Each of you today, or maybe beforehand or after, will receive some resources on what the National Bicycle and Pedestrian Documentation Project is. We'll also share with you the rationale for selecting the bike ped count locations, and we'll talk more about that in our breakout session in a few, as well as going over the standard screenline count form. So that's what our volunteers use when they're conducting counts, and we can talk more about that, and we can talk more about how the process actually goes. But I just wanted to share that with you all in general about how we conduct counts and why counts are important each and every year. So thank you so much. I look forward to speaking further during the breakout session.
Great, thanks Shikoria, and thanks Mike. I think we're at the point in the schedule for a break. Is that correct, Debbie? Where'd she go?
That is just a few minutes. I know that we've all been sitting at our screens for a little bit. It's always good to get up and move a little bit. So we
Control.
should,
Yes.
I guess we can go ahead and get started again, everybody. I will get off. And I think for our next session, we have Lisa Campbell and Sonia. Lisa is going to be our moderator, and it's on local government. And I guess, Lisa, you'll share that we have two additional guests.
Yes, I will. All right, so everybody's set to go. Let's see, we have Laura is here, Alex Venegas is here. Let's see, Christine, we don't see you.
There she
Oh,
is.
there's Christine, hi there. And yeah, we have Alex. So welcome to Local Government Initiatives, Engagement with Community for Safer Walking. Okay, so
Lisa,
I'm
is
Lisa
Heidi,
Campbell.
Lisa, is Heidi on this as well?
Yes, yes.
I am
Hi,
here, and John Bolechek should.
John Bolechek.
Okay.
Yep, there he is. Okay. All right. So let's see. Well, I'm Lisa Campbell. I'm with Bike Loudon. So even though we're a bicycle advocacy group, what's good for pedestrians is good for bicyclists and vice versa, because we're all looking for safety in our world. So just a couple of housekeeping things, reminders, remain on mute for your microphone and your camera unless you're part of the session. Put your questions in chat. Hopefully we'll have a little time to go over those. And we'll be sharing resources at the end of the session. So, all right, so today we have Laura Ghosh, Christine Meyer, and Alex Venegas. We have John Bolechek joining from VDOT. He's the statewide bicycle and pedestrian planner. And we also have Heidi Ritter. She's also with VDOT, the bike, pedestrian, and park and ride lot coordinator with VDOT. So Laura, she is the transportation engineer with Loudoun County Department of Transportation and Capital Infrastructure. She has a passion for improving the safety, accessibility, and mobility of multimodal transportation in Loudoun County. She excels in her role as the bicycle pedestrian coordinator for the traffic engineering team at Loudoun County's Department of Transportation and Capital Infrastructure. Whether directing countywide prioritization studies, managing traffic signal warrant, and innovative intersection improvement analyses, developing a pilot program for shared use mobility devices, or reviewing corridor studies and conceptual design, Laura is an advocate of livable communities and safe streets. Christine Mayer, she is with the Complete Streets program. She's the manager in the Transportation and Environmental Services in Alexandria. She is a principal planner and Complete Streets manager. She's held positions in the public, private, and grassroots organizations working on a variety of issues. In her current role, she manages and coordinates efforts to improve traffic safety as well as multimodal accessibility and mobility through the Complete Streets program, Vision Zero, implementation of the pedestrian and bicycle master plan, and capital projects, as well as infrastructure efforts for safe routes to school and trails planning. And we also have Alex Venegas. He is a certified public manager and is a principal planner in Prince William County's planning office. In his current position, he has worked as the project manager on numerous small area plans that have been adopted by the Prince William County Board of Supervisors. He is currently working as a project manager for the land use, housing, and mobility chapters of the comprehensive plan. In addition to working for the community, he has devoted his time by having served on numerous boards and commissions through both gubernatorial and Prince William County Board of Supervisors appointments. Okay, so we have some discussions to start. Let me get to the right thing. There we go. All right. So I just read in Streets blog this week that pedestrian Deaths are up 50% over the past decade nationwide. While some of Northern Virginia communities are built out and aging, others are under development. What are the top 2 pedestrian safety issues in your community? And Alex, I'll start with you.
Thank you, everyone. It's an honor to be here today. I think in our community, 2 of the biggest challenges that we have are missing segments of our pedestrian facilities that offer safe travel to people's points of destination. We find these more likely in our older segments of our community. For newer developments, we utilize the complete streets approach that ensures dedicated areas for pedestrian, bicycle, and mobility. We currently are developing an interactive map of all of our trails and sidewalks that allow individuals to provide comments on damaged or missing facilities, as well as any safety concerns, hoping to utilize that more to improve our capital improvement program to augment the connectivity of these pedestrian facilities. So that's the first major challenge that we experienced in our community. The other big component is education. It's great we have partners like many of the folks that are here today, but pedestrian safety is definitely a shared responsibility amongst drivers, pedestrians, bicyclists, and we really, from the stance in our community, we really need to take a more aggressive approach in the way we reach out to folks and educate them on safety, and acknowledge that that we need to be cognizant that a lot of these facilities are shared, whether it be pedestrians or bicyclists, and as well as areas of our roads that are utilized by multiple types of modes of transportation. So from our standpoint, I think the biggest safety concern is those missing segments that create situations that aren't necessarily safe for individuals, and then the education component. I think those are the 2 biggest issues we have here in the county.
Great, thank you. Christine, how is it in Alexandria?
Thanks. I'd say our top 2 safety issues, and I think Ralph did a great job earlier of sort of going through the gamut of all the issues that we're all facing, and Mike as well, Mike Doyle. But I'd say for Alexandria, because we've got such a mix of urban and sort of suburban areas of our street network, turning crashes are a really big problem. Especially left turns, those tend to be the most deadly. Distracted driving is another really big issue that we're all facing. And I think the turning crashes really speaks to a number of issues, which is vehicle design, how we're designing and phasing our signals, our traffic signals and pedestrian signals, and distracted driving as well, because many drivers will claim that they don't see someone trying to cross when there's other everything, being safe is probably still a factor in that. I think overall the kind of undercurrent for it is retrofitting for us, how we retrofit our streets to be much safer than they were designed to be originally.
Great, thank you. Lauren, Loudoun County, what are your 2 top pedestrian safety issues? Oh, Lauren, you need to unmute. Thank you.
So I definitely agree with everything that Alex and Christine have mentioned already. I have a couple to add. One is in our residential communities, the roads are very wide because we like to allow for parking, but then there's no curb bump outs at places where pedestrians cross or to facilitate crossing, and also to calm the traffic. So if there's no one parked along the road, we see a lot of speeding. We have a traffic calming program in Loudoun County that addresses that. Nonetheless, it would be great if new developments could install those, and then we don't have to worry about retrofitting as much. But then also we need to worry about retrofitting to account for that. The next one is safe crosswalks across collector and arterial roadways. As kind of mentioned during one of the keynotes earlier, you have to meet a minimum of 20 people crossing in an hour, or 10 people in 3 consecutive hours, or 10 very vulnerable people, either elderly people or super young people or people with disabilities. And so that becomes difficult to implement a county-wide program, because we have to go out and count basically every location that we would see or anticipate seeing people crossing. And so that's another one. And then finally, Loudoun County roadways are very dark. We're a very suburban area, and there's not a lot of street lighting. And so if you look at the data statistics for pedestrian crashes, you'll see that the majority of them occur in evening or dark conditions. And so street lighting is key to reducing those.
Great, thank you. So next, Laura, we'll continue with you. What are 2 things that you wish for to improve in pedestrian safety moving forward?
Okay, so we are very fortunate in Loudoun County to have a board of supervisors, that's our elected officials, who are very interested in active transportation right now. And so they have allowed us to implement systemic programs like the Sidewalk and Trail Program, which completes missing links, and also the Intersection Improvement Program, which I use to implement bicycle and pedestrian improvements in specific locations. And then we've also started to develop a community street lighting program. So I was trying to think of things, in addition to what we already do that would be useful. And I think a systemic crosswalk program that would allow us to go into communities that already have a lot of pedestrian infrastructure, but the crossings at specific locations need upgrading. And so I'm looking forward to if/when that 20-person requirement would be reduced. If not, we're thinking about using mobile or data collected through mobile personal devices to maybe justify and meet that requirement. And then number 2 would be solutions for arterial and collector roadway traffic calming or speed moderation. And so I already talked about, and it's already been discussed why we need to moderate speeds. So that would be the second.
Okay, one thing you've mentioned, there's a timeline that it takes from the initial concept of a project to actually bringing it to fruition, which I think a lot of people may not understand how long it takes because of the process. Can you briefly explain that?
Yeah, sure. So in traffic engineering projects and bicycle and pedestrian projects that involve installing a new link or a crosswalk take much longer than the average person anticipates. And that's because we need to go from initial concept development planning to land acquisition and utility relocation to construction. And on average, that can take 5 years. If land acquisition is difficult, it can take longer. If we're impacting wetlands, it can take longer. And that is kind of from the moment that an elected official directs staff to look into a problem, we need to develop a scope of work and run the planning aspects of that project, collect accounts and everything. And then it needs to be budgeted in the cycle to go into the design phase. So yeah, 5 years. It's a long time, unfortunately. And because of very limited resources, not just from a funding aspect, but also from the availability of raw materials like steel. And I'm sure people have heard that the cost of plywood has gone up. It's very, very difficult to accelerate that.
That's true. Thank you so much. Christine, how is it for you? What are 2 things you wish to improve?
Yeah, for pedestrian safety, it's again going back to our crossings, both our uncontrolled and controlled crossings. So how we program our signals to address our pedestrian phases, and then how we're treating our crosswalks that are existing and then requested across all of our streets really, but mostly the arterials and collector streets. I mean, the MUTCD changes are definitely a big factor in there that we're looking forward to hopefully kind of seeing some improvements and further allowances. I think thinking bigger picture, if there's a way in the future to legislate distracted driving and mandate those apps on our phones that don't allow things to come through while we're driving, especially at higher rates of speed. I think that's really important. Like someone mentioned earlier, we've got so many of these treatments for inside of the vehicle occupants and drivers, but we need to be thinking about people outside of the vehicle as well.
All right, that's a very good point. Very good. Alex, how about you? What are your two things you wish for moving forward? Oh, you're still muted. Oh, one more time. There you go.
Okay, thank you. I think that getting the funding to complete a lot of these tasks that everyone just talked about, such as the missing segments, so that we can have more complete streets, safety improvements at crosswalks, especially in our older areas, older developments that don't necessarily have those types of facilities in place. Lighting is also very important at night. So getting the funding to do those types of activities, I think would be high on my wish list. And then also mentioning earlier where I had talked about the educational component, I'd really like to see more of a consolidated bicycle and pedestrian safety program within Prince William County. A lot of times components of these are housed in different departments. We have a lot of different pedestrian trail programs or studies that are being done, and they're done in different departments, such as the Safe Routes to School. And we did a recent study, a couple of years back on the Dale City Safety and Connectivity. We received a grant to do that. But these different items are housed in different departments. I would like to have a more consolidated approach where we have a dedicated committee that can look at these things and talk about these things. So that way we make sure that we're addressing them in a timely manner, and that we put our resources towards those efforts.
Great, thank you. While we're on this part of the panel, oh, Laura, did you have something you wanted to add?
Yeah, do you mind if I add another one? I've been thinking about this, and it has to do with Loudoun County is growing really rapidly, and so a lot of our infrastructure is implemented by developers. And while we have ways to easily measure traffic and the performance of traffic of those proposed networks, we don't have a lot of good measurements for pedestrian activity. So, our CTP policy for pedestrians says that pedestrian routes need to be direct and safe. But we have no concrete solid measurements. So it often comes down to yeah, it looks sort of safe, or it's very difficult to respond, no, this is not good enough. And so I would, and I'm hoping that the MUTCD will come out with a little bit better guidance for measuring pedestrian safety at intersections and directness of route.
Okay, great, thank you. This might be a time, John, if you want to jump in and add anything to this part of the discussion before we move on. I don't know if you're prepared, but oh, you're muted.
Yeah,
there you
sure. Go. I guess I'll mention two things. The first would be just one thing to improve safety would be just to not miss any opportunity to do so. There's things in your control and there's things outside of our control. And Ralph talked about some of them, like, driver quality and vehicle design and AASHTO. But the things that the localities can control is things like bridge replacements, making sure you're keeping track on what VDOT bridges are getting replaced and what accommodations you want to see there and the policy there. Also, which applications are submitted for Smart Scale and some of the other projects that come to VDOT, maximizing those for safety. And then I know Fairfax County is really good at this, and others in Nova are getting, but maximizing your opportunities when you're doing repaving to look at improving safety there, whether it's through roadway reconfigurations or road diets or adding crosswalks, things like that. And then I guess number 2, I would say is I think a good opportunity for improving is some of these pilot treatments that VDOT is looking at that haven't really been done before. So like dwell on red and side mounted pedestrian hybrid beacons, left turn hardening, things like that. So I think there's some innovative stuff that can start to move the needle forward as well.
Great. Heidi, do you have anything to add?
Thank you, Lisa. On the kind of local facing side, I think it can't be said enough about the role that local comp plans or other plans, whether it's a corridor study, small area plan, the role that those play in what a community looks like. So VDOT works with localities on what's in the comp plan. So infrastructure projects come from comp plans or those other planning efforts. And for citizens to be involved, I mean, any day of the year, but especially during comp plan updates, mobility plan updates, that's extremely important because that does set, exactly what things might look like for the coming years. So right now, that was really highlighted last night. Alex hosted Prince William County, Trails Plan, Mobility Chapter, public meeting. Prince William County, Fairfax County, and other local jurisdictions currently have local plans that are being updated. So I would encourage everyone to, get plugged into the schedules of when those plans might be upcoming for the whole jurisdiction or even a corridor.
Right, that's really important for people to just stay abreast of when these events are coming up, meetings, public presentations, and it's so easy now with Zoom for people to attend these things and listen in and help out. So moving on, how can community members make a difference on a local level? And what is the most effective way for a community member to reach out to local government? Christine?
Sure. So I think first, how you can make a difference is first understanding how your community government works and how decisions are made and how projects are funded and things like that. So sort of taking a little bit of a step back and sort of understanding the context that the planners and engineers are working within, kind of to the point of Alex and Laura earlier. Understanding the priorities. So Alexandria, we're taking a really strong focus from our complete street side and Vision Zero on our equity emphasis areas as defined by COG. So sort of understanding the priorities from that sense that there are areas of our city and our jurisdictions that have not gotten as much focus as other, more well-funded and traveled areas. So sort of understanding where the gaps are and what staff is trying to do from that sense and match sort of the citywide or countywide policies there. I think too, kind of applying to be on boards and commissions if you feel really strongly about these things, getting involved that way to make your voices heard. And then for, just to sort of get to know the person sort of working on these things at a ground level, invite them to an organization meeting. Like if you're like a Bike Loudon, or for us, for Families for Safe Streets in Alexandria, Mike and I talk to each other very often now. And yeah, just getting to know them, inviting them to meetings, trying to understand their workload and things that they're working on has been really helpful.
Great, thank you. Laura?
Yeah, so I made a list for myself, I think, and it might be a little bit of repetitive, but I feel like it's a good idea. So first, getting involved in your comprehensive transportation plan developments. I use that every day when I'm trying to decide priorities or figure out what's supposed to be part of a design. And at the comprehensive transportation planning stage is when you can have an enormous impact on the type and extent of the facilities that are going to be implemented in your jurisdiction. And comments received during that planning process are highly impactful, and even more so if they come through a local advocacy group or like a specific community. So if they're coming from multiple people or representatives of multiple people. So that leads me into my second observation, which is involvement in your local bicycle and pedestrian advocacy groups, such as Bike Loudon or Families for Safer Streets or Loudon Walks or similar organizations in your jurisdiction is very highly impactful, not just during comprehensive transportation planning phase, but also as I conduct projects. We often reach out to those organizations to have a representative participate in our stakeholder more technical meetings. And so that really has a high impact on how things are planned and what is desired for a smaller type of study during the planning stage. The third, I think it's important to understand that, at least in Loudoun County, we need to be directed by our elected officials to initiate a project. And sometimes that direction comes through the adoption of a budget or the continuance of an established program, but it also comes through board member initiatives. And so our elected officials are very interested in active transportation, but also really value comments made by their representatives and inquiries into a potential project by their residents. And they're even more interested if that request is backed by the majority of a community or an organization, and also if it pertains to a safety issue. So I encourage you to reach out to your elected officials. And then finally, the last thing is involvement during project development. So during project development, your lived experience and familiarity with an area can inform engineering design. And we typically hold multiple public meetings at various stages of the project. I think the challenge is the general public often doesn't know what kind of feedback would be most impactful at any particular stage of our project. And so I kind of summarize my observations about what would be most impactful. One is comments regarding prioritization really needs to be provided in the planning stage of a project. Comments related to expected functionality are most impactful during the development of a conceptual design. And comments related to specific design elements, such as whether a beloved family tree will be impacted by the project, or a noted pedestrian desire line, so that's where you and your neighborhood note that a lot of people cross. And those are more impactful during the design review type public meetings. It's also, because it can be difficult to discern what type of feedback is most appreciated during a public meeting, if you're uncertain, feel free to ask what type of feedback would be most impactful at this stage of the project. And most people running that public meeting should be able to tell you what they're looking for. So feel free to ask that, and if your feedback doesn't quite fit, give it anyway. And I think that hopefully that helps set expectations.
All right, great, thank you. Thank you. Alex.
Yeah, I just think, building on what Laura and Christine had mentioned, it's very important if citizens want to participate in the process. There's multiple avenues for them to do that. Again, some of the ones mentioned earlier, such as volunteering for committees, commissions, boards that have oversight over some of these elements. Also, there's a lot of civic associations down here in Prince William. I give presentations to our local PEL, our Mid-County Civic Association. Those are great opportunities for people to voice their concerns and be heard, and they can do it collectively. Also reaching out to your magisterial district supervisors, really helpful too, because a lot of times they have the opportunity to initiate directives, as Laura had mentioned, that guide staff to look into these things with a little more perspective. And then also, as Heidi had mentioned earlier, participating in events, for instance, like this is a good opportunity, but also last night we had our comprehensive plan mobility chapter update where we focused on our trails and connectivity. And, we provided an email address, which was mobility@pwcgov.org. And just this morning, I had over 25 emails from people with suggestions, ideas, which is really great, because sometimes there are things that we don't think of unless we really see it firsthand or if we hear it from someone. So opportunities like that, reaching out to, government officials, whether they be politicians or your local transportation board. I think those are some great ways to start the process and to be involved and to make sure that your concerns and thoughts are being heard.
Great, thank you. Just one more thing, since Alex, Christine, and Laura are on the planning side in their communities. Heidi, you're with VDOT, so you're overlooking things that are in place. What is the best way for community members to reach out?
Thank you, Lisa. Let's see. So there is the planning level stage for VDOT as well. We do work on plans and as well as projects. Most of those will be on a project specific or plan specific basis. So at all our public meetings for projects, the project managers will list their personal contact information, phone and email, as well as usually a project website link where you can go and view the specifics of a project or study and submit feedback, usually to like a project comments email address. So I would encourage folks to either attend those virtual public meetings currently, or VDOT has on our website, we have a projects page where you can click on Northern Virginia and see all of the projects and studies that VDOT is involved in currently. Click on those and there should be contact information for the project manager. Additionally, for the Northern Virginia District for bicycle and pedestrian matters, you can email me directly anytime. I can put my email in the chat pod if folks don't already have it. But I serve as a Northern Virginia district point of contact. John is our statewide point of contact for any statewide matters or other areas of the state.
Great, thank you. So I think we need to try and stay on the schedule. So we had one more question and we're going to pass on that for now. So if there's Debbie, you want to step in?
Sure, that was just amazing. And I know that it's really great to hear your different perspectives. I want to move us on to, I think we're ready for the breakouts. And this is really exciting for me. Hopefully it will not be exciting for you all. You had a we are next going to get ready for our final session. We'll just wait a few seconds for people to come back on. Here we come. So it worked. I can't believe it.
It did. We weren't finished, but that's okay.
I know, I'm sorry. It's never enough time. Yeah.
That's okay.
Well, it's 3:44 and we go till 4. I don't want to have people stay longer.
Right.
So this is our final wrap up. I really appreciate everyone sticking it out. And I hope that you'll have some feedback and insights. Kate and Kraft from America Walks and Sonia are going to lead the ways to engage, and I'm going to stay in the background a little bit. But before I hand it over, I just want to thank you all, thank our amazing presenters. I feel like there was a lot of great resources and ideas and opportunities. Last year we talked about all the different resources of data and tools, and this is really kind of the implementation. So I look forward to hearing, and just a heads up that we're hoping to do a training on learning how to develop stories, you know, your traffic stories. And that would be like an hour webinar, hopefully before the end of September. And also I have a TAC, a Technical Advisory Committee, and we have our Share VA Roads work. So all of you are welcome to that. So I'll get off and let Sonia and Kate go ahead.
Thanks, Debbie. As Debbie said at the beginning of this workshop today, this is the third of a series, and what we had hoped to look at today was how communities, the initiatives that communities can do to make these changes happen. And in fact, you know, in my experience as a local advocate, it's only through strong local advocacy that you really get any change to occur. I think Ralph gave us some information on what's happening around Europe and how those changes have happened. And we're going to ask him in a minute to give us his 2-minute observation on what made that happen. But before we do that, I wanted to get a chance to hear from you about your breakouts. The objective was to help you understand how to do those kinds of community efforts, whether it's a count or a near-miss documentation in your local community. So I guess, Mike, I'm going to turn to you to give us a little overview of what you heard during your session.
Yeah, sure. Thank you. So we heard some really good questions about how you get access to the to the survey, which is on our websites. And then some people had some questions about the actual survey type of boxes to fill in. And there's multiple incidences in one area. Will they show up? Yes. How do we share information? Yes. And some constructive observations, I thought, on it. So this seemed to be a good engagement, which is great. It's what we hope to have. So thank you.
Yeah. So do you think we're going to see a lot more near-miss observations and data?
Well, ideally, no. But in reality, yes. And with that data, we can help. It helps us in our advocacy to make changes in the regulations, to make changes on the streets with the different authorities, policymakers.
Yeah, can I just add one more point? I think as far as the community sort of engagement aspect, part of the dialogue was, you know, we ran out of time, but how do we get the survey out into people's hands? Because it is crowdsourced data. So, you know, encouraging anybody here in the meeting or in the breakout to think about, share it with their communities. There was a conversation about using Nextdoor to share it out, or reaching out to your elected officials and having it shared that way. So I think, you know, how do we actually get this into the hands of folks so we're able to collect as much information as possible?
Thanks, Sonia. Okay, thanks, Mike.
You're welcome.
Victoria, what were the key takeaways from your breakout?
Yeah, so during our breakout session, discussing bike ped counts, we talked about how and why we choose count locations, the rationale behind that, hitting on the equity lens. Then we got a great question about bike lanes and gentrification, and also access to bikes themselves and access to access to community entities as well. We also we detailed the process for how one can get started with doing bike ped counts in their local communities.
Thanks. Thanks. And I think that there were a number of other communities that want to do counts, and hopefully, and we'll give the resources, and hopefully they'll be able to do that. Counts, near miss data, they're all tools that we use to make the case for why these changes need to happen. Ralph, you're the expert on how communities make change happen. So any words of wisdom you want to leave us with here today?
If I had the golden bullet, that would be great, but I don't. I have some observations that happened, and in the beginning here, you alluded to the question how this happened in Europe or in the European cities. And one of the items that I had presented was there was safety related. In the 60s and 70s, seeing the negative impacts of cars, mainly on neighborhoods and inner cities, and people wanted to have that space back. And a lot of that was grassroots driven. It was citizens, residents who wanted safer conditions for walking and cycling, who wanted cleaner air, and who wanted the space back from cars. And they pushed local governments and national governments to make changes. And it's great to see a full Zoom webinar here, full with people who are excited to do exactly that. For example, in Germany, they saw what the Netherlands were doing in terms of traffic calming, and they pushed German engineers to implement traffic calming in Germany. Germans thought that's something the Dutch do. We don't do that. And they started with trial projects in various cities, and they saw it worked. And as more people saw it work, they wanted that as well for themselves. That's important. It was sort of step by step. It was not in the beginning, like I showed these maps of all the traffic calming in these cities. That's not how they started out. It didn't start out and say, hey, residents of X, listen, we're going to traffic calm 80% of the streets. It was step by step, neighborhood by neighborhood, sometimes street by street. Sometimes it was easy, sometimes it was hard. Like the street where the video that I showed or tried to show that didn't run, that mixed zone, that was a shared street. There was a referendum in the end because it was so controversial, and they put it out for a referendum, and the people voted to have it as a shared street. I think we may have a unique opportunity, and it may close fast with COVID and people having been pedestrians and cyclists more, and we have chosen to use car parking for outdoor eating or for sitting outdoors. We've closed off entire streets, so we have reduced speed limits in neighborhoods for people to use it and to experience it as a pedestrian, as a cyclist, with less or no interference of cars. And I think we have to build on that and try to capture that momentum. But it will sort of, if we don't manage to capture it, it will sort of go away very quickly. And of course, data are very important. And so it's great that we have count programs. We have the near miss cases to make the argument for walking and cycling. One last point I want to make is, and because we have some government officials here as well, I think it's important. Their role is very, very important because they are in the city administration. They are working with engineers and developers who may be more car oriented, but getting through to them that they should consider walking and cycling in their day-to-day decisions is very important. Because if you're not at the table when the decisions are made, or when a new road resurfacing, a new bridge, or whatever it is comes up, if you're not there in terms of the interests of walking and cycling, it will not get in there. So there's a very important role for the government officials here to educate their colleagues about the needs of pedestrians and cyclists and make it part of their daily routine to think about the needs of pedestrians and cyclists.
Thank you. I believe we have, we may have, a miracle may have finished a couple of minutes early here. As Debbie said, we're going to be following up with a webinar in the not too distant future on really how you tell your story. so using the data, using what we've learned about what's going on in communities, how do we make a compelling case to advocate for safer streets? It's kind of weird that that's something you have to advocate for, but so that's the situation. Debbie, I'm going to throw it to you. Thank you all for joining us. We will be sending out an evaluation, so do please fill that out.
Thank you all so much. I do have a quick poll, I think, which is basically similar to the evaluation, but I don't know. Let's see, polling 2. They're not. So just if you give me 30 seconds or a minute, it's just if you feel like you found actions that, well, that's great. So let's see if I can share it. I think there's a way. I'll give you another, yeah, we have another 5 seconds. I mean, but that's awesome. So I think everybody can see that. Oh, no, you can't. Here, now you can all see it. That it seems like we did get some good, effective tools. But I will be setting out an evaluation. I really appreciate you all sticking through the whole end of it. And I look forward to partnering with all of you and working towards greater safety, both as a resident of Northern Virginia and in my role as a planner on the Share VA Roads program. And thank you again to my amazing coordinators, Sonia, Michael, Lisa, Kate, and for our great presentations. Thank you again. And Mike, sorry.
Thank you, Debbie, for pulling us all together. It went really well, and I've learned a lot.
Thanks. Now I have to figure out, hopefully we will keep all of our chat. I think it automatically saves. Here we go, save chat.
I was just gonna say, I just saved it too. So
okay, good.
Thanks, everybody. Take care.
Yeah.
Thank you, everyone.
Thank you, guys. Polls.